Mr. Speaker, may I have your permission to answer questions 1 to 4 together?
Go ahead.
My response will also address the oral questions 73 to 75 from the order paper on the 22nd of September 2025. Allow me to begin by putting the issue into perspective. The Ministry of Health has previously explained the current state of private healthcare and insurance. Insurers, private hospitals, and providers have got themselves tied up in a knot, resulting in escalating private hospital bills, rising premiums, and more safeguards introduced to the claims process. The concerns raised by members point back to this deeper issue. A significant root factor is the design of private health insurance. Insurers know that policyholders are worried about unexpected large hospital bills, so they offer plans with generous coverage and benefits through integrated shield plans, IPs, and riders, covering almost to the last dollar with little co-payment. But when someone else, in this case insurers, pays for almost the entire bill, the dynamic between patients and providers changes. There is tendency for over-servicing and unnecessary treatments. This is backed by data. The likelihood of a patient with a private hospital rider making a claim is 1.4 times that of a patient without a rider. The size of the claim is also on average about 1.4 times that of a patient without a rider. Rising private hospital claims put a strain on insurance. For IP portfolios to be sustainable, insurers raise premiums to cover claims. Policyholders have seen sharp increases in premiums for private hospital plans, namely IPs and riders. They also introduce more safeguards to manage claim costs, which helps insurers moderate the premium growth to some extent. So, in response to the member's question, Mr. Fadli Fauzi is right that features such as S-charged expands coverage and contributes towards weakening the discipline of insurance claims. There are other features too, such as covering deductibles and co-payment, which also need to be looked at. But private healthcare insurance is in its current unsustainable state, not because of collusion or anti-competitive behaviour. That usually leads to super normal profits by market players at the expense of consumers. Here, insurers are either making losses or barely breaking even on their health portfolios. The situation is due to excessive competition that has gone wrong, another type of market failure. Mr. Yip Hong Wing and Ms. Mariam Jaafar ask if there could be new laws for stronger regulatory oversight. We already have a Competition Act to prescribe collusion and anti-competitive behaviour. If we strengthen regulatory oversight, it should be to correct the market failures arising from unsustainable and self-harming competition that have taken place today. Regulations to prevent insurers from correcting the current problem will likely exacerbate the situation, make private insurance even more unsustainable with no market correction mechanism. Should there be disputes over specific claims, policyholders can take it to the Financial Industry Disputes Resolution Centre, FIDREC, an independent and impartial institution that assists with insurance-related disputes. The Monetary Authority of Singapore, MAS, will also take action against insurers if they do not pay claims in accordance with policy terms and conditions or have unfair claims handling practices. MOH will continue to work with MAS to exercise regulatory oversight over IP insurers and products. Members also ask about the practice of pre-authorisation. Pre-authorisation is an administrative arrangement, not a contractual benefit offered by insurers. It enables insurers to review and approve medical treatments and associated fees to make sure that they are medically necessary and covered by the policy before they occur. This arrangement also gives patients the assurance about what will be covered. Today, 5 of the 7 IP insurers provide pre-authorisation. Regardless of pre-authorisation, IP policyholders enjoy their full contractual benefits and can still make claims for their treatments according to the terms and conditions of their policy. Panels are another means that insurers use to manage claim costs by ensuring that the doctors on the panel adhere to fee ranges set by the insurer. Seeing a panel doctor typically allows policyholders to enjoy more favourable co-payment terms. All policyholders remain entitled to their full contractual benefits, even if they seek care from a non-panel doctor. Most insurers have at least 600 private specialists on their panels. MOH monitors insurers' practices and works with them to ensure adequate panel coverage at the overall and speciality level. With extended panels, most IP insurers also allow policyholders to access doctors on other IP insurers' panels, subject to review. The trends we see: escalating costs, premiums, tightening claims management practices are consequences and symptoms of the knot that insurers, doctors, hospitals, and policyholders are caught in. Regulation will not loosen this knot. It will make it worse. If we restrict insurers' claims management practices, we will likely see even larger premium increases. And if we cap premium increases, products will become unviable, which will hurt policyholders. So we need to loosen and untie this knot step by step. Every stakeholder needs to do its part, and MOH will facilitate the process. We have urged the insurance industry to relook their overly generous policy design, such as minimal rider co-payment. Insurers will need to balance between providing assurance and protection and encouraging prudent consumption and servicing. We will do more to educate consumers on choosing the appropriate health insurance coverage for their needs. We are in fact launching a public education campaign soon. To rein in sector cost increases, MOH has developed and published over 2,800 fee benchmarks, which providers and insurers reference to set fees and review reimbursements respectively. We will study what more can be done to guide fee setting by private hospitals. MOH will also continue to work through the Multilateral Healthcare Insurance Committee, MHIC, which brings together key stakeholders from healthcare providers, medical professionals, insurers, and consumer representatives to address these issues collaboratively.